Good afternoon, ladies and gentlemen. It's getting a bit late in the evening, so I'll be very, very quick. Unlike my clinical colleagues that have appeared here before you and presented to you, who are probably very familiar with sodium valproate and Epilim, I knew very little about this until last July, I'll be honest with you, when the correspondence went out to GPs primarily, because my area of responsibility is in community services and dealing with the GPs. I was asking some questions of my GP colleagues as a result of it, and indeed I think that's probably how I landed with the job of actually looking at the community response, because I put in a number of questions to our national system. And therefore, I suppose, when they were looking for someone to lead on the community response, I was asked to do so. I also had to, page down here. I also had to look at a team to put in place, because I knew very little about it. I had to do a lot of research myself, and I had to bring people on board who actually understood it. And we were very lucky to have Karen, who came on board with us to work with us on the community response piece. And we had a number of other professionals then who actually also gave us some supports in terms of developing a care pathway, which we're currently working through at the minute. In terms of the project aim, it was to develop that pathway of community health and social care support services for people and their families who have had an FVS diagnosis, which is also referred to as a fetal anticonvulsive syndrome diagnosis, specific to exposure to valproate during pregnancy. The project objectives were to identify for those adults and children, because I think part of the difficulty for us is that the data, as Ronan has gone through earlier on, was quite sketchy, and we didn't actually have any quantifiable data to work with. In such situations where, in the past, where you actually had very, very clear numbers to work with, you could put together very clear business cases to actually develop services. In this instance, we didn't have that concrete data, but we did have to try to put something together in terms of how we could put support requirements locally in place through the community and social care services, and develop that community pathway of care. The recommendations, which we're still currently working through, because we still have to present the final report to the working group, which is chaired by Deirdre McNamara. But the subgroup's recommendations are based on a 12-month interim programme. Now, you're probably wondering, why is it a 12-month programme? It's, I suppose, to do two things. One, to try to put in a programme fairly quickly to provide those care supports, but also to start quantifying the implications, because I think that's what we need to do, is quantify the numbers, and we're going to use this programme to do so as well. Also, we're looking to make a recommendation around an initial multidisciplinary team approach to determine the health and social care supports needed for the client group and their families. And the programme would also include an evaluation to support the development of a long-term mechanism for the assessment of individual cases in a straightforward basis as possible. I was very interested in what Joe Cousins had to say about a valproate passport, because we mightn't have called it that in terms of our discussions, but that's what it's actually starting to look like as we've talked about it, and Karen's input, I've no doubt, speaking with Joe over the last number of months and years, probably helped shape our thinking around that. So that's the way we're moving. While we haven't put a formal name on it, it looks like it's moving in that direction. In terms of our next steps, and again, I was hoping to speak with more detail here today, but given that we're still very much in the final discussions in terms of the draft, and indeed we have a meeting next week, myself and Karen and Jeff and Deirdre McNamara, to actually work through some aspects of the final report that we would hope that we'd be able to sign off in the next week or two. But basically, the work stream is still in development. I think we're on draft 7 or 8 of the proposal. We've had great input from Karen and indeed from OACS in relation to it. And we will continue to work with the stakeholders, the persons themselves and their families impacted, patient representative bodies, OACS included, and indeed others as appropriate, to get this over the line. We are looking to progress the recommendations to the expert working group with the key dependencies, because there are a number of key dependencies that will actually have to be addressed as part of this process. And we're hopeful to get that done over the next number of weeks. Thank you.